case. Mrs. A is a 64-year-old female with no significant past medical history, but surgical history of hysterectomy who presents to the hospital with abdominal pain and distension. She knows that she has not had a bowel movement or passing gas since yesterday. She has been having nausea and vomiting. The ER has ordered a CT which shows a small bowel obstruction with a transition point. You were asked to admit the patient. How can you help this patient acutely, and what would you need to do otherwise? So this is another very common admission that you're going to see in the hospital, a small bowel obstruction. And in this case, what you need to think about is that this patient had a history of a hysterectomy, and anytime you have any kind of abdominal surgery, you run into the chances of developing adhesions inside the abdomen. When that happens, these adhesions can actually push and on the intestines or twirl around the intestines and cause, obstruction of the actual intestines. So your bowels are not going to be moving, you're going to have an obstruction. A lot of times when you do the CT scan, it will show that the patient may have a small bowel obstruction, and they may indicate this transition point. They'll tell you, I'm seeing something right here that beyond it, there is nothing moving. And before it, you have the distension. And again, this is how they can see the small bowel obstruction. If you have some sort of an adhesion, you probably want to get surgery on board because they can go in surgically and they can lyse these adhesions surgically.